If we look at the wastewater surveillance across the province, it's pretty clear that those are headed in the upward direction in many parts of the province. And, because we're not doing widespread PCR or testing throughout Ontario and then actually in most parts of Canada, you have to look at other indicators. And wastewater is certainly a very good one and an early indicator.
Parts of Canada are experiencing wave 6 of COVID-19, we are told. A sixth wave, where there's an inching up in COVID-19 case counts and an inching up, unfortunately, for those hospitalized with COVID-19. So what should be done about all of this? And when it comes to all of society responses, should anything even be done in response to all of this? So we're hearing from some doctors quoted in news stories, speaking out on social media that we should not have lifted restrictions in Canada, that we did it too soon. We shouldn't have ended mask mandates. We're going to have to soon bring them back in. But is that actually going to happen? Is that the case? Is that what people want to see happen? Let's not forget that a number of public health officials, Dr. Bonnie Henry in BC, Dr. Kieran Moore in Ontario, a number of others across the country, they've talked about the need to learn to live with COVID. They've talked about the fact that we're dealing with an endemic virus, meaning COVID-19 is not going away. Remember, there were hopes back when this thing first started that maybe somehow it would just disappear. We'd do this 2-week hard lockdown and it would just be gone. It would just disappear. Well, that didn't happen. There was hope that the vaccines would not just protect against severe outcomes like hospitalizations, but they would eliminate transmission. So basically just shut this whole thing down. That didn't happen either. What we're instead seeing around the world is many people getting COVID-19, thankfully, becoming very milder with the Omicron variant. And in a lot of places, they're not even mass testing. In Ontario, public health officials have said they believe the official number of cases is actually 10 times, perhaps, what's being reported. You go, oh, wow, that means there's a lot of cases. But maybe the good news to that is, and the hospitalization rate is so low, despite what appears to be an explosion in cases among low-risk persons. So are we going to see a push to bring back in new restrictions? I don't think that's going to happen, because we have heard from various officials talking about the fact that there's the vaccines available, there's now the treatments available, and they are actually doing testing such that they go and they try to micro-target in their testing. They use testing strategies that try and identify the people who are most likely, more likely to be hospitalized about it, so they can care for the people who are the vulnerable. Going back and really focusing on the vulnerable. I think that's the approach that public health is going to want to take moving forward, regardless of the headlines we see about there being a sixth wave. Because they talked about this being endemic, meaning you can keep counting those waves for as many years as you want. They're going to keep coming. But this idea of these overarching broad-based restrictions on everybody's lives, on children's lives, on very low-risk persons, I don't think they're coming back. What do you think?